Good morning, everyone, and welcome on this lovely spring Nova Scotia morning. My name is Ardra Cole, and I'm the Associate Vice President, Academic and Research here at Mount St. Vincent University. And it is my sincere pleasure to welcome you, to all of you, and on behalf of the Mount, to be hosting this very significant release of the food costing report. Under the leadership of Dr. Patty Williams, the Participatory Food Costing Project is playing an essential role in building understanding and awareness of the issues surrounding food security in Nova Scotia. This morning, we will hear the results of the 2010 Nova Scotia Participatory Food Costing Report entitled, "Can Nova Scotians Afford to Eat Healthy?" We will learn more about the harsh realities facing many Nova Scotians who struggle to afford a healthy and nutritious diet. And we will gain some insights into the difficult decisions many individuals and families face in meeting their most basic needs. Access to affordable and nutritious food is a serious issue in Nova Scotia. The Nova Scotia, that's a reminder. There's nothing so grounding as that wonderful sound. The Nova Scotia Participatory Food Costing Project has been examining this issue since 2002. This represents a 10-year partnership between the Nova Scotia Food Security Network, family resource centers, and other community partners working with families vulnerable to food insecurity, universities, including the Mount, and government partners. To date, the partners have provided invaluable data that have contributed to policy change. The provincial food costing model, the only in Canada that uses participatory research approaches, is recognized nationally as leading-edge, innovative policy and practice-relevant research. This project and the partnerships that make it possible reflects Mount St. Vincent University's commitment to issues of social responsibility in the advancement of women, and our vision of developing thoughtful, engaged citizens who make a positive impact on the world. But the reality is that much more is needed to ensure that all Nova Scotians, regardless of financial circumstance, have access to a nutritious diet. I would like now to introduce Dr. Patty Williams, Associate Professor and Canada Research Chair in Food Security and Policy Change in the Department of Applied Human Nutrition here at Mount St. Vincent University. Dr. Williams is also the director of the newly established Participatory Action Research and Training Center on Food Security at Mount St. Vincent University. Dr. Williams is joined by Beth Baker, at the end, project coordinator from Memory Lane Family Place in Lower Sackville, and Jacqueline Smith, a food coster from Bridgewater, both partners of the Food Costing Project. So each person will take a few minutes to share her perspectives on the research results and the consequences that we all face. So it gives me great pleasure at this point to turn things over to Dr. Williams, who is going to take a few minutes to highlight the research findings. Dr. Williams.
Thank you, Dr. Cole. Good morning, everyone, and thank you all for being here. Participatory food costing was first conducted in 2002 with funding from Health Canada. We've since conducted food costing 4 additional times with funding from the Department of Health Promotion and Protection. Formerly Health Promotion and Protection, I should say, the new Department of Health and Wellness. The overall goal of food costing is to monitor the cost and affordability of a basic nutritious diet, as well as the availability of locally produced foods in the province. As Dr. Cole mentioned, Nova Scotia is unique in that participatory processes are used to engage partners from diverse backgrounds in working together to build food security. This means people who have firsthand experience with food insecurity or who work with people experiencing food insecurity are involved in decision-making, in training, in data collection and analysis, and communication of the research findings. At the core of this research are 54 committed individuals, Jacqueline and Beth being two of those individuals, from 15 family resource centers and other community-based organizations throughout Nova Scotia. These are the people who either collected the data or supported the data collection or training or the workshops that were held throughout the province to share the findings and reflect on the findings back in the winter. On behalf of the partners in this study, I would like to thank the Nova Scotia Department of Health and Wellness for their support, their collaboration, and their continued commitment to this issue. I would also like to thank the many individuals and organizations, many who are here today, over 80 partners for their commitment and invaluable contributions to this research. Working with our partners, we've been able to further understand the issue of food security and the steps that we need to take as a province and as citizens together to influence change. Food security is a complex issue. There's no getting around that. We don't suggest that there's one single solution. Since we last released our 2008 data in April 2009, many steps have been taken at both the provincial level and the community level to build food security in Nova Scotia. But our current research shows that much more is needed. So let me start by first explaining food security. Food security means that all people at all times have access to enough safe, healthy food that's produced and distributed in sustainable and socially just ways. In a household, food security means being assured that everyone, that is all members of the household, at all times have access to enough food for an active and healthy life. Food insecurity, on the other hand, means not being able to access enough healthy and safe food or worrying about being able to do so. A key driver of food insecurity is not having enough money for a healthy diet. Food insecurity means that a mother or father worries about how to put healthy food on the table. Our study weighed the cost of food and other basic needs against government assistance incomes and wages in Nova Scotia. What we found is that many Nova Scotians are at risk for food insecurity. Putting it simply, individuals living in low-income circumstances are faced with difficult, often impossible decisions. As we review the research, I would like you to consider the following 3 points. First, many individuals and families in Nova Scotia simply cannot afford to eat nutritiously. Since 2002, the cost of a basic nutritious diet for a family of 4 has increased by 35% in Nova Scotia. That's 35% since 2002. The average cost of a basic nutritious diet to feed a family of 4 is $770.65 a month. That's $97 per month more than a basic nutritious food basket in 2008, just in 2 years. And that is for a no-frills diet, a diet based on shopping in one grocery store only and where meals are made from scratch. No organic foods or no foods from farmers markets. No convenience or snack foods, no consideration for special dietary needs, no baby foods, no dining out, and no extras for special recipes, for celebrations, or birthdays. Second, the continued inadequacy of minimum wage and income assistance rates affect not only individuals, but entire communities. This inadequacy poses a significant risk to the health of Nova Scotians and contributes to the weight on our health system.